Tu podcast w głowie się mieści. Okay, so hello everyone. It's Wrap Your Head Around It podcast. My today guest, Dr. Michael Greenberg. He's a clinical psychologist, and he's specializing in the treatment of the OCD, obsessive compulsive disorder, and he's a director of the OCD Associates, which is also the clinic about the treatment of the OCD. Yeah, and not only clinic, but in general, you have there, I saw many materials for people with OCD. Yeah. Great. Yeah. And thank you again that you joined my podcast, my episode about the OCD. And maybe I introduced you in a few words. Maybe you also wanted to say something more about yourself, about your experiences, why you chose to work to focus your work on OCD and so on.
Sure. I think anybody who's listened to my stuff knows that I treat OCD because I have OCD. It's not that direct, but bottom line, that's how I got interested in OCD. And I think that my work has always been a consequence of personal necessity, meaning I needed help. And so I was figuring out like what I needed to do to feel better. And then that was a parallel process with figuring out what to do for my patients. And so when I confronted the limitations of what ERP could do for me in terms of rumination, that was the starting point for thinking about how to treat rumination and how to revamp ERP. And then realizing that I needed personally to work on underlying emotional dynamics was also part of what got me interested in psychoanalytic perspectives on OCD. And of course, all of that is at the same time as working with patients with OCD and realizing the limitations of what ERP could do for them. So basically, like I said, it's been a parallel process the whole way.
Okay, so on the one hand, it was like your own work with OCD, and you saw the things that were worked for you, then you were using it in the treatment of your patients. Yeah. Yeah, and you are also the developer of the rumination focus therapy for OCD, the ERP. Yeah, and like I know that some people like they treat ruminations as a compulsions, but not everyone. And what was your way, just like to discover that the rumination could be a compulsion?
So I think that the idea that rumination is a compulsion is not original, meaning I think people know that rumination is a compulsion. I think what I added to the picture is how much of what goes on mentally is rumination, is a compulsion. So when I was starting out looking for guidance for my OCD when I was in college, so quite a while ago, I remember finding things that said you need to stop ruminating, but there were two things that were missing. One was that there was really no guidance about how to stop ruminating, and
yeah, it's easy to say.
Right, exactly. And I struggled mightily with it. The other piece that I think is really actually the most important is differentiating different, what I read online back then suggested that you have intrusive thoughts And those are the obsession, and
Mm-hmm.
you have to let those be there. And then separate from that, you have rumination. And for anybody who has OCD, you know that like is a very there's just chaos in your mind. You know, there's
Yeah.
just like a total mess of thoughts and thinking, and
Yeah.
where that line is very confusing. And so people back then, I think, thought that there were sort of intrusive thoughts that took up space, as it were. And then there was also
Mm-hmm.
rumination that took up space. And so you needed to let the obsessive thoughts be there and take up their space without letting the rumination be there. And what I realized over time was that really beyond there are thoughts that occur to you, but they don't really take up any space, as it were. I'm saying that metaphorically, but I think it's the best way to think about this,
Mm-hmm.
at least from my perspective, and to realize that all of the thinking, that all of it, everything that takes up any space is all compulsive. And there is nothing that you need to like allow yourself to think beyond, I mean, with a tiny detail there that you have to allow a thought to occur to you, right? You can't try to push things
Mm-hmm.
out of, prevent yourself from a thought occurring to you. But beyond that, the whole thought process, start to finish, is all compulsive. And so there's no part that you're supposed to allow to be there. And moreover, my realization
Mm-hmm.
was that rumination is trying to figure something out. Trying to figure something out is analytical thinking. Analytical thinking is controllable. And so all of this, start to finish, is controllable. So I think that
Mm-hmm.
before this approach, people thought that somebody with OCD has intrusive thoughts over and over again, like you're a pedophile, you're a pedophile, you're a pedophile, or whatever it might be. And then they start doing
Yeah. Yeah.
compulsions. And so there are these two separate things. And what I am saying is that's not what it looks like. The whole thing is just a person sitting there trying to figure out if they're a pedophile. There's not this
Mm-hmm.
first part.
There. Mm-hmm. Yeah.
There's no blip. It's not like you're a pedophile, you're a pedophile. That's not what this looks like. That's what people thought it looked like. But really, the whole thing, start to
Mm-hmm.
finish, is a person sitting there trying to figure out if they're a pedophile. And so the whole thing is analytical thinking, and the whole thing is subject to a person's control.
Okay. And what's the difference between having, for example, an automatic thought and the intrusive thought? Because it's also the
That's a great
interesting.
question. So I actually think that the term intrusive thought is actually, even though I accidentally use it also. Okay, like I did a
Mhm.
podcast recently, and I listened to it afterwards, and I was like, oh, Michael, like, I can't believe you said that. But I think the term intrusive thought is actually not an accurate description of what's going on. Um, for the majority of people, I'll speak in a second to where that is maybe relevant, but let's say it's like 1%.
Okay.
In the vast majority of cases, it's not intrusive thoughts. There's no thought that's just, attacking you. It's literally you sitting there trying to figure something out. And so I think that people
Mhm.
use the term intrusive thoughts because that's what the field uses. That's what everybody who has OCD uses. We're used to this terminology. Again, even I use it, and I know perhaps better than
Yeah.
anyone that this is not an accurate way to describe what's going on. So I don't
Mhm.
think that what are intrusive thoughts. I think that's what people who did not have OCD were imagining was
Yeah.
going on. I think somebody would come in and they would say, I can't stop thinking that I'm gay. And so I think that got translated into somehow like as if somebody from the outside were saying this, where really nothing is coming from the outside, and it's just you sitting there trying to figure something out. I do think that in a minority of
Yes.
cases, we have this is what people used to think, this was all pure O, but really I think it's a minority of cases where we
Mhm.
do have somebody who's engaging in thought suppression, where they're literally trying to stop a thought from occurring to them, and then the thoughts are there and they're trying to push it away. um, there, I think it would be more accurate to describe that as a thought being intrusive because it's occurring to them and they're pushing it away.
Mhm.
But that is, again, that's in like a tiny minority of OCD cases. Um, and I would include that as like a subcategory of like sensory motor OCD, where a person is trying to stop paying attention to something. Um, Whatever. That doesn't. That's
Mhm.
how I
Like
see it. But
the feelings from a body. Yeah, like for example.
Well, I should explain what I'm saying. So sensory, you know what? I think actually I'm getting a little too complicated for the podcast. So suffice to say, we can talk about sensory motor separately, but suffice to say, in the vast majority
Okay.
of cases, 99% of cases, intrusive thought suppression has nothing to do with it. And intrusive thoughts is a mischaracterization of what's going on. And I think people only use
Mhm.
that term because people historically have used that term and we're all used to it. So I think a more correct way to say it is a person is just sitting there ruminating. The whole thing is a person sitting there ruminating.
Yeah. Yeah, so it's like a more a process. Yeah, like when you are saying about the process, it's similar for me. For example, when someone wants to fight back something, yeah, like to figure out a thing, and then he's trying to find it, he cannot do it, and then he is doing it over and over again. Yeah, and then it uh, uh, emphasize the tension, the emotions, yeah, in inside of him, and then comes a compulsion or um,
I am not sure I followed that. I'm sorry.
okay, so uh, like okay, yeah, because I think that I've missed, but uh, the rumination could be also a compulsion. Yeah, so like
Yes, it's a
people
compulsion.
because the maybe we can also figure out what exactly mean compulsion.
Hmm.
Okay.
So you want me to define compulsion? Yeah, I
Yeah,
would
yeah,
define
if
compulsion
you
as anything a person feels like they don't have a choice about doing. In other words, not like cleaning your room, but where you experience yourself as not having a choice. You're
Mhm.
tapping this thing or going back and thinking about something, and in that moment, it feels like you don't have a choice. Does that make sense? So I think a
Mhm.
core part, I would say that that's sort of what characterizes compulsion and what characterizes OCD in general is feeling like you're doing all of these things that you don't actually want to be doing. And I think that maybe
Yeah.
one core component of treating OCD is restoring a person's sense of agency or restoring their awareness that they do actually have control over these things. So we want to take somebody from feeling like they don't have a choice to recognizing that they're terrified
Mhm.
of what will happen if they don't do this, but they do have a choice. And that's empowering and restores a person's agency. And then we use that to help them make the decision to not do things that they don't want to do. So that's my definition of
Mhm.
compulsion is something a person
Okay.
is doing that they feel like is out of their control.
Mhm. Okay, and like we started to talk about, I think the types also of OCD, the pure O and the OCD related with the body sensations, and maybe you could say something more about the types of OCD
Hmm.
and maybe they have some
Sure.
differences.
So just to clarify for anybody who's listening, um, there are not really people think that it's like either you have contamination OCD or you have sensory motor or you have just right or you have pure O, and that's not at all what things look like. In reality, people have all sorts of combinations and different symptoms. Those are not different types of OCD. They're just ways that we describe different types of symptoms that people have. So anybody listening who has OCD should know that it's quite common to have symptoms that are different types of symptoms, as it were. There's not really a separate type. We call, in other words, it's just a description. Yeah, yeah.
Mhm.
Um,
Yeah.
I do categorize OCD into three types of cases, but the categories are not based on what types of symptoms a person has. To to me, the categories are
Mhm.
based on the underlying emotional dynamics and what types of feelings are being avoided. I think that to go into that would probably be beyond the scope of this podcast. So for anybody who's interested, there's an article on the website called and three types of OCD cases. And so if you're interested in that, you can check that out on the website. and it describes categorizing all OCD cases into 3 types. Not just OCD cases, anxiety, phobia, social anxiety, whatever. All, to me, those are all the same thing. So if you're interested in that, go check it out. But in terms of different types of symptoms, you want me to just sort of mention different types of OCD symptoms people can have? We have people who are just ruminating. We call them pure O. Like, they're people who are not doing any physical compulsions, at least that they're aware of. They're just sitting there all day, every day, frantically trying to figure out the answer to a question that haunts them. Maybe that question that haunts them is, am I in the right relationship? Maybe the question that haunts them is, am I a pedophile? Maybe the question that haunts them is, maybe the question that haunts them is
sexual,
right? Am I a different sexual orientation from what I think I am? It could be, but it could also be random. It could be like, it could be very person specific. It could be like constantly trying to figure out if I am, whatever. It could be any lazy, hardworking, whatever happens to be the question that, because of that person's upbringing and emotional dynamics around a certain issue, has become the question that haunts them. Fine. So that would be our pure O. We have people who have concerns around contamination, where some of them are afraid that if they contaminate something, something bad will happen to someone. And for other people, they're afraid of the feeling of contamination itself getting out of hand. That somehow everything will be contaminated, and then there will be no way to escape it. We have just right cases, which to me are lumped in with rituals. And these are people who feel compelled to do something, whether that's to touch something, tap something, turn in a circle, close the door, whatever it might be, move their body a certain way. And they're parallel to the contamination cases. There are also 2 types, where we could have somebody who's afraid that something bad will happen if they don't do it. And then we could have somebody else who's afraid, not that something bad will happen, but that feeling of urgency will persist forever if they don't nip it in the bud with a compulsion. So for example, if I have this urge to do X, what if I don't do it? And then that feeling is forever, or that feeling is going to persist until I do it. What other kinds of cases? I guess the last one that bears mentioning would be sensory motor. And these are people who are paying attention. We could call it hyper awareness, but in my language, I prefer to call it hyper attention. These are people who can't stop paying attention to something. I'm not going to give examples of this one because I think it's one that people can get preoccupied with. If you do get preoccupied with it, see the website. There's some good guidance for getting out of it. But anyway, I just don't want to trigger anyone. So that would be somebody who can't stop paying attention to something, whatever it might be.
Great. Thank you. And how much of the OCD is related to some critical events in their childhood in the past, and how much is related to the biological factors like temper, for example, on maybe some other?
I think people don't know this, but a lot of people don't realize that the debate over nature versus nurture has pretty much been settled. We know the answer, and the answer is interactionism, which means it's both. It's always both, and they interact with each other over and over and over again. So I think we know pretty clearly that there are biological and hereditary factors in OCD. But to me, it's also very clear that there are emotional and relational factors in OCD. And in all cases, it is possible to understand the person's OCD in light of things that have happened to them, emotional dynamics in their family, relational dynamics. So it's always possible to understand it in light of past experiences. That is not exclusive to biological factors, meaning everybody comes into this world with a temperament. People have different personalities. People have different predispositions to various different things. And that can be true here also. So I think that's basically the answer. We know there are hereditary factors, but there are also environmental factors. Historically, the field of OCD has totally ignored emotional and relational factors, which to my mind is ridiculous, like it's laughable. Like you'll have these people who are talking about their OCD, and they're talking about like, oh, here's everything that happened to me as a child. I was raised in an abusive home where I never knew when my mother was gonna come home drunk, and et cetera, et cetera. And I
Yeah.
have OCD, and as if these things have nothing to do with each other. Like to anybody who's whatever, it's pretty obvious to me that these things have everything to do with each other. Um, and I think that
Mhm.
is usually borne out by what happens in therapy as you like sort of look at what's going on. But historically, the field of OCD and specifically the field of CBT for OCD has treated OCD like it was just a neurological anomaly, like a blip in your brain or a
Yeah.
broken brain. It has nothing to do with emotional
Behavioral. Yeah.
factors, which is
Yeah.
laughable. But that there is a history of totally ignoring emotional and relational factors. And yeah, so to my mind, it is obviously both.
Yeah. And also, I saw on your page that you also study the analytic therapy.
Mhm.
Yeah, and it's also, I think, close to you. Is it like those
Mhm.
theories, and how they, from the analytic
Mhm.
perspective, maybe also how we can understand
Mhm.
OCD?
So I think maybe just to explain to anybody who's listening, there are different schools of thought within psychotherapy. And two of the big ones
Hmm.
are CBT on the one hand and psychoanalysis on the other hand. So CBT means
Yeah.
intervening. Is this something that anybody listening would know, Adam? Like, should I explain this or no?
Um, yes, because the my audience is on the one hand it's the specialists, but also there are some people who are just interested in the
I see.
psychotherapy
Oh, so
and
most people listening are therapists. Oh, got it.
yeah,
So they don't,
yeah,
sorry,
yeah,
I've been talking as
mostly.
if I was talking to a lay audience. I didn't know I was talking to therapists, so I apologize. To anybody who felt patronized,
Yeah,
I
but you
apologize.
but the psychotherapists they send some episodes to their patients because they treat them
I
also
see.
like a
Hmm.
psychoeducation.
So,
So
okay. So, with apologies to people listening who know very well what CBT and psychoanalysis are, although notably, at least in the US, a lot of people think they know what analysis is, but they really have no idea what analysis is. So, maybe there are some people like that here too. So, so the two big schools of thought, not the only ones, are CBT and psychoanalysis. CBT is cognitive behavioral therapy, which means intervening on the level of
yeah,
conscious thoughts, things that a person is thinking, and behavior, meaning things that a person is doing. So, examples of that would be challenging irrational thoughts, would be an example of a cognitive intervention,
yeah,
and doing exposure would be an example of a behavioral intervention. Okay. Um, and then
yeah,
psychoanalysis is thinking about a person's feelings, like a person's emotions, and a person's emotional conflicts. Meaning, for example, I am, just as one example, let's say I am really, I really am angry at my mom, but well, I don't know. I'm just making up an example. I'm really angry at my mom, but my mom
or
is the only,
maybe
but my father
yeah,
is absent. He's not here. My mom is the only parent that I have. So to
yeah,
feel angry at her is very scary because I'm afraid of losing her, or maybe to see her as bad in any way is scary because maybe she's the only parent that I have. And so to see her as bad is too scary. Or maybe she's narcissistic and she retaliates or reacts badly when I see her that way. So just as an example of a conflict. So looking at a person's
yeah,
feelings
yeah,
and emotional conflicts in the context of their relationships. And that includes a lot of theory about how these things work and how people consciously and unconsciously understand the world and organize the world and
react, yeah.
navigate emotions. So that's psychoanalysis. CBT is much more cut and dry. You can sort of there can be a manual, like here's how you do the treatment. And psychoanalysis
Hmm.
requires like years of study and is a growth process that is probably lifelong. So even though I've studied
Hmm.
psychoanalysis, basically the treatment of OCD historically has been dominated by CBT therapists. And psychoanalysis has been sort of left out of conceptual. Well, that's not really true. I would say basically the psychoanalysis is not considered an effective treatment for OCD. And even very prominent
Yeah.
psychoanalysts, I've heard Nancy McWilliams said this, and David Mallon was a psychoanalytic writer that I talk about him in my writing. And he says in his book, like, psychoanalysis often does not help people with OCD. And so there's good reason that behavioral treatment, CBT namely, and specifically ERP, has dominated OCD treatment. However, it is my belief, as well
Yeah.
as Mallon's belief, that taking ideas from psychoanalysis and perspectives on what's going on from
Mm-hmm.
psychoanalysis can enhance treatment for OCD. So I'm not suggesting that part of my work is learning about psychoanalytic perspectives on OCD and thinking about how we can integrate that into a cognitive behavioral treatment for OCD so we can give people the best of both worlds. So I'm not advocating for
Yeah.
replacing behavioral treatment with psychoanalysis, but I am advocating for and write about integrating perspectives from psychoanalysis into treatment for OCD.
Mm-hmm. And what do you think about, for example, I just find and maybe it's not a new article because it's from 2018 about the schema therapy, the integration of the schema therapy and the OCD
Sounds like a
treatment.
great idea. I'm not.
Yeah.
I have this the tiniest bit of familiarity with schema therapy, like really just tiny, and
Yeah, yeah.
and from what I know about it, I like, but I'm not trained in it, and I don't work that way, so I don't have much to say about it. But I think the idea
Mhm.
of integrating behavioral treatment with whether it with some sort of emotionally focused work to look at what else is going on here, I think is
Yeah,
the idea. So that would be consistent with that.
yeah, because the schema therapy is also the integrative therapy with psychodynamic and Gestalt and with the some experiential techniques, the imaginary.
Mm-hmm.
So yeah, like you said, it's could be something more
Yeah.
complex, yeah, not only the
Mm-hmm.
part of the
Yeah.
treatment, the behavioral, but also the
Mm-hmm.
emotional.
I
So yeah,
I
it could be
personally really
interesting
like
too. Yep.
psychoanalysis because um, I see it as the accurate description of what's going on. In other words, there could be lots of techniques that could be helpful, but the psychoanalytic perspective to me
Hmm.
is just like the to me is the truth of what is actually happening here. It doesn't just feel like it happens to work; it happens to be a treatment that's helpful. It feels like a psychoanalytic perspective when we're
Yeah.
thinking about things like um, conflicts around healthy aggression, things like omnipotent fantasy and a wish to be able to somehow control something that you can't. To me, these ideas are so um, glaringly true. They are so evident
Hmm.
in my work that that I think that's why I value psychoanalysis specifically so much. I think it's an accurate description of what's going
Okay.
on, not just the treatment that happens to be helpful.
Hmm. Great. And what's your thoughts also about the mindfulness based cognitive therapy for OCD or to
I'm sorry, it
how
just froze for
to
me. What are my thoughts about what?
okay about integrating also mindfulness into the treatment of OCD.
Hmm.
Do you use it or
So, okay,
what's your
I think
opinion?
that
Hmm.
we can talk about mindfulness in two ways. There's mindfulness that is a regular practice, like going to the gym, right, or like eating
Hmm.
healthy,
Yeah.
and that's I think a healthy thing for anyone. Okay, but the way that mindfulness has been
Hmm.
used in treating OCD has been as an intervention for rumination. And as an intervention for rumination, I think that mindfulness is not a good solution for multiple reasons. I can go into them here, or if anybody wants to see the article on my website, there's a full article talking about why I do not think mindfulness is a helpful or appropriate answer for rumination, and why I think it can actually be harmful when it's used that way. So I can go into a bit here, but if anybody wants my full thoughts, it's on the website. So in other words, I'm not saying mindfulness is bad, but I'm saying trying to use it as the solution to rumination, I think, is misguided.
Maybe because you try to use the mindfulness use as a technique, and then you can increase your focusing on, again, on your thoughts. Yeah, is it something like
in terms of what my objections are? Okay, I'll tell you some of my objections. Some of my objections are rumination is you doing something, and the solution to rumination is to stop doing it. And so nothing that you do is ever going to be a replacement for stopping. So in other words, like anytime that where the solution to rumination is to take something away, not to add. So sort of like if somebody were washing their hands over and over, what they need to do is stop washing their hands. There's nothing they can do in addition that will solve that problem. Okay. So first of all, trying to add anything is not helpful. On another level, sometimes people who are trying to use mindfulness for rumination will end up just mindfully ruminating. Okay, for example, there's an exercise I was taught when I was training in OCD called Leaves on a Stream. And it's sort of, so you're supposed to watch your thoughts go by. And I remember trying to implement this for my own OCD back in the day. And basically, in retrospect, I was just mindfully ruminating. You know, you put your first thought from the thought process on a leaf and you watch that thought go by. And then you put your next rumination thought on a leaf and you watch that thought go by. Excuse me. And so it is very easy for it to be used to just ruminate mindfully. On another level, in order to not ruminate, you need to be able to do it all the time. And you cannot be mindful all the time. And so asking someone to do that is saying basically like you're going to be struggling your whole life and you're going to have to constantly work hard in order to deal with these thoughts. And that's not realistic, but it's also not necessary. Like, in other words, when I teach somebody how to stop ruminating, I want not ruminating to feel like getting off of a treadmill, not running, not doing anything, and therefore something that a person could keep up all the time if they make the decision to. And if your intervention is mindfulness, then there's no way a person can do that all the time, and to try to do it all the time would be totally exhausting. There are other additional issues, like if mindfulness is used as bad distraction, like if a person is trying to push something out of their mind by focusing on the present moment. There are other specific issues, but those are just sort of a handful of potential problems with mindfulness. I do think that in a very specific way, it could be used to enhance not ruminating, meaning a person could learn to become mindful, whatever, slow things down, make the decision not to engage, let it be there, whatever. So I do think it could be used in a way that is okay. But my argument would be that in that case, it's not necessary. In that case, why did you need mindfulness? Just teach a person to stop ruminating, and you don't need to add to it. And when you add the idea of mindfulness, you're introducing someone to a whole world of like sort of messy interventions that are just going to confuse them. So in my opinion, mindfulness is not a good intervention for OCD.
Okay, thanks. And do you have some techniques that you can share with us about how to stop ruminating, like maybe something that works for you best?
Well, I have the excerpt. How to Stop Ruminating is my thing, and I do have the article on the website for anybody who wants to check it out for themselves. Okay. If we have time, which we do you want me to teach? Do you know how to stop ruminating?
I hope so. maybe maybe you can teach me.
Okay, how sounds to. Good. So let's try that. So as long as that comfortable for you to do that.
Yeah, sure.
All right.
Yeah,
So do
yeah,
you have
yeah.
some topic that if you were to let yourself, it would be bothering you?
Yeah, yeah. I have that.
You don't have
I
to share what it is. I mean, you can if you want to, but it's not necessary for the
Okay.
exercise. Okay, you have whatever topic it is. Okay.
Yeah,
So
yeah, yeah, yeah.
for the
I have.
next lot, okay. So what we're gonna do is whatever that question is, okay, we're aware of it. We know it's
Yeah.
there. And for the next 10, 20 seconds, your only job is to not actively try to solve that problem. Okay. You don't have to calm yourself
Mm-hmm.
down. You don't have to forget about it. We know that question exists, whatever it is. And all you're doing is for the next 10,
Yeah.
20 seconds, don't actively try to solve it. Okay. Just hang out. You'll solve it another time.
Mm-hmm.
Okay. Go ahead. I'll check in like 10, 20 seconds.
Okay.
What's your anxiety level from 0 to 10?
Now it's, I think,
5.
5.
Okay. Okay.
Maybe also because I am interviewing you, so maybe it's also it could increase a little bit my
Hmm.
anxiety, but
Okay.
it's 5
Hmm.
during this
So,
exercise.
including anxiety about interviewing me, okay, including that,
Yeah.
is there anything, any problem that you're trying to figure out? Even, for example, what am I going to say next? Or is this going well? Or am I going to be able to not ruminate? Or what should I be doing now? Is there anything that you're trying to figure out right now?
I was thinking only, am I doing right?
Okay. Okay.
Your instruction. It was
Okay.
the only one.
So that is something that you're trying to figure out. Okay. So we're going to do it
Yeah.
again. And this time you're going to relate to that question the same way. That's a question that exists. Am I doing this right? And rather than trying to figure that out, you're just going to sit there and you're not going to figure that out. You're not going to try to solve that problem or answer that question. Okay. You can think about whatever you
Okay.
want. There are no
Okay.
rules about what you can and can't think about. Just don't actively try to solve that problem. Okay. Go ahead.
Okay.
Let me add, if any other like anxiety provoking topic occurs to you, any other trigger occurs to you, just do the same thing. Just don't try to solve it right now. Okay? Go ahead.
Okay. Okay.
Okay, what's your anxiety level? 3?
3.
Okay. Was there anything that you were trying to figure out?
No, no. I was checking my questions, but it is okay for
It was
me.
something you wanted to do. You wanted
It
to check your
doesn't.
questions. It wasn't that you were.
Yeah, yeah,
Okay.
yeah. Exactly.
Okay.
Yeah.
So what I'm gonna do now, is there a way for me to send you something in a chat? Yeah, but
Yeah.
actually maybe it's
Uh,
better okay. I'm gonna send you the article called How to Stop Ruminating. Okay. And
Great.
then you're
Mm-hmm.
going to scroll down to the multiple choice.
Mm-hmm.
Tell me when you're there. And you're going to see it
Okay.
says 1 through 6, where 1 is trying to figure something out. So look at that list, okay, where 1 is how to stop, where 1 is trying to figure something out, and 6 is engaging in self talk, okay? Okay.
Yeah.
Which of these, if you can remember, we can do it over if you don't, which of these were you engaging in when you were sitting there trying not to ruminate?
Mm-hmm. Mm-hmm. I think that for me it was. Um, I keep trying to stay present, mindful, but my mind keeps
Okay,
me
good. Okay.
wandering.
So here we go. Here's an example of mindfulness causing a problem. Okay. So
Yeah,
so
yeah, exactly.
notably, we didn't say that you have to stay present. Okay. That was not part of
Yeah.
the instructions. You could think about whatever you want. You could think about what you're going to have for
Mm-hmm.
lunch,
Great.
what project you're working on, like where you're going to go after this. So there's no goal here of staying present. Okay. Your only job is
Mm-hmm.
just to not solve whatever problem that is. You know that problem exists.
Yeah. Not to
But
engage.
even don't
Mm-hmm.
engage is already getting too like stressful. Okay,
Mm-hmm.
that
Mm-hmm.
problem
Yeah.
exists, whatever it is.
Yeah.
It's on the whiteboard, it's on the chalkboard, whatever. You know it's there. Your only job is to hang out and not start trying to solve it. Okay? You don't have
Mm-hmm.
to be mindful at all. You don't
Great.
have to be calm. Your only job is don't pick up your pen metaphorically and start trying to figure it out.
Mm-hmm.
Okay? Let's try it again.
Great.
See you in like 10, 20 seconds.
Okay.
Okay? What's your anxiety level?
I think it's two. I don't perceived my anxiety now as a
You don't
issue.
feel anxious right now?
Like it's
From
no, no.
0 to 10, what is it?
It's
3.
free.
Okay, so that's not 0.
Free.
So let's keep going. Okay. So
Okay.
which of these things were you trying to do? Let's look at the multiple choice. By the way, this is something that happens with patients too. They're like, oh, I feel better. And you're like, well, you just think this is as good as it gets. Okay. So let's look at that list
Yeah.
for 3 out of 10 anxiety, which is still pretty significant. So which of those
Mm-hmm.
things are you still doing?
Mm-hmm. I keep worrying that I'm not doing this
Okay.
right.
What are you
Maybe
trying to
it was like
what are you trying to figure out?
I was trying to figure out, am I doing properly? Like, am I find the right thing on your page? Yeah, like it was. I think that it is. It was something like this.
Okay. So trying to figure out if you were in the right place, trying to figure out if you're doing the exercise correctly.
Yeah,
Yeah.
yeah.
Okay. Anything else?
No, no, no. Maybe
Mhm.
also because sometimes when I switch from Polish to English, it takes some time for me, to establish a good level, and it also sometimes pops my
Mm-hmm.
mind. But
So,
yeah,
is there anything that you're trying to figure out around that? Like, are you sitting there trying to figure out if it was bad, trying to figure out how to make it good, trying to figure out?
yeah, I try to figure out that maybe you will ask me some questions that I
Okay, so
misunderstood,
you good.
and
So you
then I would have a problematic
good. Okay, so
situation.
you're really analyzing. You're really trying to figure out if that happened, if that's going to happen. Okay, so
Yeah.
so identifying that as a problem you're trying to solve or a question you're trying to answer. Okay, and also, am I doing this exercise right? Let's relate to those again as things that you're trying to answer right now, and your only job is just any topic like that that occurs to you. We're not going to try to answer that question. Okay, so
Hmm.
you're not trying to be
Okay.
mindful, you're not trying to be calm, but if something occurs to you, a thought occurs to you, like, did I say the wrong thing, or did I get myself across, or did whatever, is he going to say something I don't, whatever it is, just don't try to solve that problem right now. Okay, let's try again.
Okay. Okay.
Anxiety level?
Yeah, I think that it's now my anxiety level is 0. I don't feel
No,
anxious.
not at all. Good.
No,
Okay,
not
so
at all.
then that's so it was a pretty simple case. Okay, so that's how to stop ruminating. So there were 2 things that you were struggling with. Sometimes there are 6 things here, so there are 6 different things that people can sometimes struggle with. You only dealt with 2 of them. Okay, 2 sub points that you had were
Hmm.
trying to figure something out. Okay, like analytical thinking, rumination proper, And that came up in different ways because you didn't realize something was making you anxious, but you didn't realize that you were trying to figure something out. Once you realized that you were trying to figure something out, that you identified that, you were able to make a decision to stop trying to figure it out, and your anxiety went down, right? And then the other thing that you got stuck on was trying to do mindfulness. Okay. And then so we addressed those two stuck points, and then your anxiety went down to zero. So that's how to stop ruminating. And what it shows you is that if you stop ruminating, you stop feeling anxious.
Yeah, totally. Yeah, it works like I maybe wasn't so much aware before the topic about also the thinking what would happen if I didn't understood you well, and so on and so on.
Yeah. In other words, I think what you're pointing out is that sometimes we feel anxious about something, or sometimes we feel anxious and we don't realize we're thinking. And we definitely sometimes don't realize that we're trying to answer a question or figure something out. We just think we're anxious, and there's nothing we can do about it. I'm anxious, and what should I do to stop? Maybe I should distract myself. Maybe I should do a breathing exercise. Not that those are bad, but they don't address directly the fundamental issue, which is that the reason you're feeling anxious is because you're sitting there trying to figure something out. Yeah. So if we can address that directly, we get to the root of the problem, at least on a cognitive level.
Great. And where we can find some more information about Ruminating Focused ERP. I know that on your webpage, which I put into the description of our podcast, but maybe somewhere else.
I mean, my best, there's still more in the pipeline that I need to write, but that most of it is there, especially for the cognitive behavioral elements of the treatment. It's really all there. Mostly, there's a little more I need to write. So yeah, check out the website. There's an article explaining how to do a rumination focused exposure. There's an article explaining how to pick targets for exposure. There's an article talking about how to decide what is and is not a target. And there's an article called Order of Operations, which is literally like an outline of the whole treatment start to finish.
Great. And do you organize somewhere some workshops that maybe for the specialists from Poland, maybe they want to learn in the more active way, where we can find some workshops? Or
we do an RFERP, Rumination Focused ERP training through the practice that I teach. It's an 8-week course, 1 hour a week for 8 weeks, and it teaches you all the basics of Rumination Focused ERP and gives you a chance to implement it with patients, ask questions.
Great. And do you recommend some books about the OCD for the therapists? That maybe not only for the in general.
I actually don't recommend CBT books about OCD because I think that most of them are based on a fundamental assumption that that we treat OCD through habituation, which I don't agree with and I don't believe in. And so, unfortunately, there are no CBT books about OCD that I really like. Yeah, I mean that is the simplest answer to that. If somebody wants to, I'm not saying that the books are globally bad. I mean, I'm sure there's valuable stuff in them, but they all kind of are based on a big assumption that I think is false about how we treat OCD.
Yeah. So maybe not
CBT. So if somebody wants to read about psychoanalytic perspectives, I think the Malin's book, Individual Psychotherapy and the Science of Psychodynamics, is a good intro to psychoanalytic perspectives, though it's not the be-all, end-all. What else? I mean, I love Nancy McWilliams' chapter on the obsessive compulsive personality, though that is not really about OCD. But I guess those are my two. If you have to start somewhere on psychoanalytic perspectives, those are two good places to start.
Great. I think that we don't have much time, but it could be also interesting how OCD is related to the
Mm-hmm.
personality. Yeah, is it like to having the OCD P? Is it something that can increase the possibility of having the OCD
Well,
or
the way I would
no?
think about that is OCPD. Okay, who am I talking to? Lay people, or am I talking to therapists? Okay, we'll give a little intro. How much time do we have?
We
Okay,
don't
we have
care
like
much.
5 minutes. So, um, basically, for those
Yeah.
who are not familiar, um, OCD is people who are doing, the rituals, the ruminating, and then OCPD is about personality problem. It's called obsessive compulsive personality disorder, and these are people who are rigid,
Yeah.
controlling, moralistic, my way or the highway, um, etc. And
Yeah.
um, uh, when we talk about having a personality disorder, it sounds like we are talking about something categorical, black or white, either you have it or you don't have it. And it also sounds like we're talking about
Yeah.
something that a person has, like strep, like something external, like they have this thing external to themselves that's making them sick. And a more correct way of thinking about it is that everybody has a personality, and everybody's personality is characterized by
Mhm.
certain defenses. Certain way A defense is a way that you navigate the world emotionally. And when a person's defenses are um, when their style of defenses is taken to an extreme, to like dimensionally to an extreme, meaning not black or white,
Yeah.
then
Very
yeah,
rigid or yeah.
rigid or problematic or distort reality, then
Yeah.
we might say that they have a personality disorder. So it's not something that happened to them; it's their personality that, in a sense, is taken to an extreme that causes problems. And also, it's not black or white. You could basically, Nancy McWilliams talks about thinking about personalities on a scale from very healthy to unhealthy, and a person could be anywhere along that continuum. So you could have an obsessive compulsive personality who is very healthy, and you could have one that's really unhealthy. We might say that that person is OCPD. Okay, but really we're saying this is an obsessive
Hmm.
compulsive, and they're really unhealthy. So people emphasize that these are very different disorders, and in the DSM they're separate disorders. And even Nancy McWilliams says that not
Yeah.
everybody who has OCD has an obsessive compulsive personality. But I think that we've actually taken that to an extreme of, like, underscoring how these are separate, separate, separate. And the truth is, I think they're not so separate. I think that in the vast majority of people who
Mhm.
have OCD, they also have obsessive compulsive dynamics in their personality. And again, just anybody who
Yeah.
doesn't know this, that's not bad. Everybody's got a personality. Everybody's personality could be described in certain terms, whether that's depressed or whatever. The terms don't matter. So saying that somebody has a more obsessive compulsive personality and that they're gratified by doing and thinking, um, that is that's not bad. That's just a description of one way that some
Mhm.
people are. And I do think that many people who have OCD are people who also have obsessive compulsive personality dynamics, though not necessarily disorder. So I think that
Yeah.
often when we start addressing the underlying dynamics in OCD, what we end up addressing is obsessive compulsive personality dynamics, things around
Personality.
moralization, things around intellectualization, things around conflicts around aggression,
Yeah.
control, dirt, money, time. These things are relevant in most
Yeah.
cases.
Right. Yeah. So also the morality. Yeah. Like in the classical CBT, where like you don't want having your intrusive thoughts because you are you think that you will be a bad person having those such a bad
That's a
thoughts,
good
for
point.
example. Yeah.
Yeah.
Yeah. Okay, so
Yeah.
Michael,
Thank you so much
thank
for having me.
you very much for your openness, for sharing your knowledge. Thank you very
Thank
much.
you. Thank you for the opportunity.
Yeah, and thank you, and hope to see you maybe
Sounds
someday
good.
again.